Hey everyone, welcome back to Bump to Baby Life. If you're expecting your first baby, congratulations. Today, we're going to talk about your first prenatal appointment with your doctor or midwife. This visit is an exciting milestone in your pregnancy journey, and we're here to help you feel prepared and confident. We'll cover everything from what to bring, what tests to expect, important questions to ask, and how to make the most of this crucial first visit. So, let's dive in. When to schedule your first prenatal appointment. Most healthcare providers recommend scheduling your first prenatal appointment as soon as you find out you're pregnant, typically around 6 to 10 weeks. Some may see you earlier if you have underlying health conditions, a history of pregnancy complications, or concerns about your symptoms. It's important to call your doctor or midwife as soon as you get a positive pregnancy test so they can schedule you accordingly. Keep in mind that the earlier you begin prenatal care, the better for both you and your baby. Early prenatal visits can help identify any potential risks, ensure you're taking the right vitamins, and provide guidance on the first trimester symptoms you may experience. What to bring to your appointment. To make the most out of your visit, it's a good idea to bring a few important things with you. A list of any medications, vitamins, or supplements you're taking, including dosages. Your medical history, including any pre-existing conditions, past pregnancies, allergies, surgeries, and family health history, especially conditions like diabetes, high blood pressure, or genetic disorders. A list of questions or concerns you have about pregnancy, including symptoms, lifestyle adjustments, and labor preparation. Your insurance information, ID, and any necessary paperwork required by your provider. A notebook or phone notes app to jot down important information from your visit. What to expect during your first prenatal appointment. Your first visit will likely be one of the longest, as your provider will gather important information about you and your pregnancy. Here's what typically happens. Medical history review. Your doctor or midwife will ask detailed questions about your health, lifestyle, previous pregnancies, if any, and family history to assess any potential risks. This helps them provide personalized care and identify any areas that may need closer monitoring. Physical examination. Expect a full physical checkup, which may include checking your weight, height, and blood pressure to establish a baseline for your pregnancy. A pelvic exam to check the size and position of your uterus and look for any abnormalities. A pap smear, if you haven't had one recently, to screen for cervical cancer and sexually transmitted infections, STIs. Breast examination to check for any lumps or abnormalities. Checking your thyroid and general physical well-being. Blood tests and lab work. Your provider will likely take a blood sample too. Confirm your blood type and Rh factor, important for preventing Rh incompatibility issues. Check iron levels and screen for anemia. Test for infections like HIV, syphilis, hepatitis B and C, and other STIs. Check for immunity to rubella, German measles, and varicella, chickenpox, as these can be harmful during pregnancy. Test for thyroid function, vitamin D levels, and other important factors that can affect your pregnancy. Urine test. You'll provide a urine sample to check for protein and sugar levels, which can be early signs of preeclampsia or gestational diabetes. Urinary tract infections, UTIs, which are common in pregnancy and need to be treated promptly. Due date calculation. Your provider will estimate your due date based on the first day of your last menstrual period, LMP. If you're unsure of your LMP or have irregular cycles, they may schedule an early ultrasound for a more accurate date. Ultrasound, possibly. Some doctors or midwives may perform an early ultrasound too. Confirm the pregnancy is in the uterus and rule out an ectopic pregnancy. Check for multiples, twins, triplets, etc. Detect a fetal heartbeat, usually visible from around 6 weeks. Discussing lifestyle changes and pregnancy advice. Your healthcare provider will also discuss important lifestyle adjustments to support a healthy pregnancy. This may include nutrition, eating a balanced diet rich in folic acid, iron, calcium, and protein. Avoiding foods that pose risks, like raw seafood, unpasteurized dairy, and undercooked meats. Prenatal vitamins. The importance of taking folic acid to prevent neural tube defects and other necessary vitamins for baby's development. Exercise. Safe pregnancy workouts, recommended activities, and those to avoid, such as high-contact sports. Avoiding harmful substances. No smoking, alcohol, or certain medications. If you take prescription medications, your doctor will review their safety. Mental health and stress management. Pregnancy can bring emotional changes, so your provider may discuss ways to reduce stress and improve mental well-being. Questions to ask your doctor or midwife. Your first appointment is a great time to ask questions. Here are some important ones. When is my next appointment, and how often will I have checkups? What symptoms are normal, and when should I call for help? Can I continue working, exercising, and traveling? What foods should I avoid? What over-the-counter medications are safe during pregnancy? What prenatal classes or resources do you recommend? Are there any genetic screening tests I should consider? What happens next? After your first visit, you'll have regular prenatal checkups throughout your pregnancy. Every 4 weeks until 28 weeks. Every 2 weeks from 28 to 36 weeks. Weekly from 36 weeks until delivery. Your doctor or midwife will guide you through each stage, ensuring you and your baby stay healthy. That's a wrap on what to expect at your first prenatal appointment. I hope this video helps you feel more prepared for this exciting journey. If you found this helpful, don't forget to like this video, subscribe for more pregnancy and baby-related content, and hit that notification bell so you never miss an update. See you next time on Bump to Baby Life, wishing you a happy and healthy pregnancy.